Hello everyone, I am Sandra May Perineal from BSN2 Geography of Double Doctors College. And today I am going to perform the perineal flushing. So perineal flushing are also known as perineal care. It is a hygienic care that involves cleaning the perineum or the genitalia. So washing this area properly is very important in order to prevent infection, odor, and irritation. So prior to the conduct of the procedure, I have prepared the necessary equipments needed in order to save time and energy. So the equipments that I am going to use are the pitcher with the warm water, 2 forceps, the working and the pick-up forceps, the 7 pieces of dry cotton balls, 7 pieces of cotton balls soaked in a cleansing solution, perineal pad, clean gloves, 2 kidney basins, alternative bedpan, dough sheet, and a blanket. Also, do not forget to perform hand hygiene in order to prevent cross-contamination as well as protecting myself and the patient. Good morning, ma'am. I'm Sandra May Perineal, your center for today. Can you please state the complete name?
Jay McKeown,
Okay, your birthday and civil status, please.
single, February 31, 2003.
Okay, thank you very much, ma'am. But before proceed, may I ask what should I call you?
Ma'am Jay.
Okay, thank you very much, ma'am. So, I'm going to explain the procedure to the language that the patients understand. Okay, ma'am Jane, ang gagawin po natin is, lilinisan po natin yung genital area nyo or yung private parts nyo po. So, this is to assure para matanggal yung normal secretions as well as para malinisan natin ng mga ayos para matanggal yung odor. And also to check na rin po if you have any infections sa perineum nyo. Okay na po ba?
Yes.
Okay, thank you very much. So, do you have any clarifications or concerns that you want to address?
None.
Okay, so I will just lock the door and put my gloves on. So this is to ensure patient's privacy and as well as infection control. So now, place the patient in a dorsal recumbent position. Okay, so now, cover her body from up to her legs. And flex her knees. And put the dough sheet first. And put the bedpan until the patient's buttocks. Bedpan is used in order to prevent the bed becoming soiled. So now, expose only the area that needs to be cleansed. For minimum exposure, lessen the embarrassment, and of course, to provide warmth. So since we're not allowed to expose our real genitalia of a woman, this printed genitalia here will be my alternative. Okay, so now we'll just inspect for the perineum and wash the perineal area with the warm water. So note for any excessive inflammation, swelling, or excessive discharge of normal secretions and the presence of odor. So warm water is used in order to prevent chilling and dissolve blood clots. Okay? So now get the cotton ball soaked in a cleansing solution by using the pick-up forceps to maintain sterility. So the first step is to clean the external labrum, starting with the midline of the symphysis pubis or external genitalia I mean, starting with the middle of the symphysis pubis down to the anus. Remember to never restroke so that to prevent contaminating the area. Then discard. So the second step is to clean starting from the mons pubis in figure 7 by way of external labium towards the anus. For secretion tends to collect around the labia minors, which is to facilitate bacterial growth. Then discard and do it in the opposite side. So with the fourth cotton ball, cleanse starting from the mons pubis in figure 7 by way of internal labium towards the anus. Then discard and do it to the opposite side. So, with another cotton ball, clean the groin going up to the thigh. So, clean the groin up to the thigh. Then discard and do it in the opposite side. Then flush the perineum with a sterile water. So now using this dry 7 cotton balls, dries the perineum with the same stroke we did earlier by using the working forceps. Okay, so now let's remove the bedpan. So now let's remove the bedpan gently and turn the patient to the side. Okay, so now let's remove. Also, if it seems necessary, take one cotton ball and clean one side of the buttocks and as well as the other side and dries them both to provide comfort since we have just the printed genitalia, but in real life you can do that. Then use antiseptic spray to promote healing. Then I'm going to place a perineal pad with an upside down motion to prevent contamination of the vagina and from the urethra from anal area. Okay, so we'll just cover the patient genitals. And let's remove the bed door sheet. And discard. So how are you feeling, Ma'am Jane?
I'm feeling fresh and good.
Do you have questions to ask before I leave?
Not so far.
Okay, so I'm now going to leave you and place you in a comfortable position first. Okay, so do not forget to do the aftercare procedure of the materials we used earlier to promote clean environment. And document or record the treatment and observe the discharge from the bedpan. For the documentation purposes, the procedure was done means it's communication. So do not forget to perform hand hygiene after this procedure.